Their default setting is a fear and anticipation of criticism, disapproval, rejection, a real sense of detachment, and an avoidance of intimacy. And there's also an element of anhedonia, which is the inability to feel good or pleasurable or joyful feelings. They're often really very anxious. Now, as I did with you last time, although this is seen as a personality disorder, I've been trying to demonstrate how we can have alternative explanations for this rather than a personality disorder in its classic formulation. We would see avoidant behavior like this is highly correlated with people who have a history of trauma.